Holistic nursing aspects, an overview. Introduction. As nurses mull over their tasks in the direction of complementary modalities, in addition to integrative care, they must possess the values of the performance of the American Holistic Nurses Association. The present standards of holistic nursing are anchored in the 5 core values of performance. Holistic nursing is denoted as a nursing endeavor where the objective is the healing of the whole person. Holistic nurses identify and incorporate the values and ways of holistic healing into everyday life, as well as medical practice. Holistic nursing persuades nurses to incorporate self-care, self-accountability, religion, and contemplation in their operations. Core values. The 5 core values embody the fundamental nature of holistic nursing and are critical for successful performance. The first core value, philosophy, theory, and ethics, emphasizes that holistic nurses identify human health practice as an intricate, dynamic association of healthiness, sickness, and wellness, and treasure healing as the preferred result of the performance of nursing. The second value, the holistic caring process, underscores the holistic nurse's provision of care that identifies the totality of the person, the connections between body, mind, feelings, spirit, community, civilization, associations, context, and surroundings. The core value of holistic communication, therapeutic environment, and cultural diversity affirms that the holistic nurse establishes the significance of comprehending the health experience of the person. The fourth core value is holistic education and research, which asserts that holistic nurses should understand a broad scope of norms and medical performances, convictions, and principles regarding people, families, groupings, and societies from a diversity of racial, religious, and social settings. The final value, holistic nurse self-care, views self-care, personal insight, and incessant focus as vital instruments of healing that are needed in holistic nursing. I rank the holistic caring process as the most important because it offers an incorporated and all-inclusive approach. Moreover, under this core value, even though physical conditions are treated, holistic nurses also concentrate on the way the person cognitively identifies and emotionally handles the sickness, the impact of the illness on the family, social affiliations, economic resources, the patient's principles and beliefs, inclinations concerning treatment, and the significance of the experience in the individual's existence. Interview. I carried out 3 different interviews, one with a female interviewee called A, names withheld for confidentiality, the second with a male friend, B, and the third with a male colleague, C. 2 of the participants, A and C, are nurses, while B is a nursing student. I first explained to them that under the second core value, the holistic caring process, holistic nurses integrate some modalities, such as stress management, with conventional nursing interventions to enhance healing, tranquility, comfort, and healthiness. I then asked them to explain why they consider or do not deem the core value a significant factor for a nurse to integrate into their practice. All the participants considered it vital for nurses to incorporate the core values in their practice. They said that the core value could assist a nurse in working together with other stakeholders all through the decision-making progression for quality care. B affirmed that through the core value, holistic nurses assume a variety of tasks such as professional clinician, leader, specialist, and an enabler of healing, to mention a few, which enhance their provision of care. C stated that the core value enables holistic nurses to establish risk aspects, for instance, lifestyle, inclinations, convictions, and age-associated circumstances that affect healthiness and help in ensuring a positive outcome of care. Healing and cure. Cure occurs in a patient when health professionals provide medicine, treatment, and other health interventions. It is normally the outcome of a sequence of treatments that results in the occurrence of the eradication of a disease. On the contrary, healing denotes an internal course that patients undertake for themselves. Healing reinstates the harmony and peace to the mind and body and could be realized devoid of a cure. Case. In my clinical practice, I once handled a patient who was diagnosed with diabetes. The patient was greatly traumatized by the diagnosis to the point of attempting suicide. When their friends and family members brought them back, I took them for counseling and later advised them on how to use a glucometer to monitor the blood sugar intensity and insulin injection to normalize the level of glucose in the body. In this case, there was no cure because the patient would have to keep monitoring the glucose level and inject themselves with insulin when necessary. However, there was healing as the patient gained peace, and through monitoring their glucose level and having insulin injections, they will lead a normal life. Description of the details. Being a patient, A confessed that she is undergoing treatment for schizophrenia, which has managed to alleviate the symptoms successfully, hinder future psychotic occurrences, and reinstate the capability to work and have a meaningful existence. On his part, B stated that his sister had a positive HIV test 10 years ago, but counseling coupled with taking antiretroviral drugs have enabled her to lead a normal life. Lastly, C stated that his father was diagnosed with epilepsy when he was young, and though drugs have not cured the disease, they have enabled him to control seizures and enjoy life. Conclusion. The standards of holistic nursing are anchored in 5 core values of performance, and the holistic caring process has been ranked in this study as the most important. The 3 participants in the interview believe that it is imperative for nurses to include the core values in their practice. The study has explained that though there is no cure in cases of diabetes, there could be healing.